sector. It doesn't help the sector. And so, when the delegation came back, I had to follow up. I was in the company with the Deputy Director General and other directors of the ministry. We joined the medical superintendent at the Rich Hospital, and I visited the victims. After going around, we had a closed door meeting to discuss the issues, not insults. One, how to look at beefing on the internal security, staffing issues. So after the closed door meeting, I came out to address the press to categorically condemn the physical response. And that is the most important aspect. And for me, let me at this point reiterate to the whole country that irrespective of the level of provocation at any health facility in this country, nobody, irrespective of your status in society, absolutely nobody has the right to attack any health professional in this country. That is the gravamen of the issue. No diversionary tactics about handshaking. That is what we must concentrate on. To send a clear signal that our health professionals working at the various health facilities are safe. And so, after the engagement with the management, when I pulled out of the wards, then, in fact, in the engagement with the management, I made it clear to them that I had listened to their side of the story. Therefore, as a minister, I will also listen to the other side of the story. And I then constituted a committee to look into the matter, bring out recommendations for implementation. A lawyer, a nurse, a medical doctor, an auditor, an HR person to go into the matter. Now, when I pulled out, my attention was drawn to a gentleman called Ralph, who was at the center of the controversy. And so he was working towards us as a group. The medical director was with me, the deputy director general was also with me. Then I asked, why did you do this, gentleman? When I asked, most of you were there, I mean the press, you were there, so you can attest to what I'm saying, you were there with me. When I asked him, the gentleman then stretched his hand, shaking me, and trying to whisper something into my ears. Ladies and gentlemen, at this point, should I push the guy that don't whisper anything into my ears? Should I snub him? Should I shout at him? Even if that guy has been prosecuted and sentenced to life imprisonment, and he stretches his hand to shake me, as a minister, as a public officer, I have the duty to stretch and greet him. So let us not reduce the fact that I shook hands with him does not mean that I should stop any measure or any steps that the ministry or government will take to unravel the situation. And so I understand, on a more lighter note, I have been reminded of the fact that I'm a farmer. Yes, nobody needs to remind me. I'm a proud farmer, and everybody knows it. Not until my appointment, I was one of the largest rice farmers in this country, and I'm proud of that. Please, we have a lot to deliver, and some of these things will not divert our attention. We will continue to do our best for Mother Ghana. I thank you for the opportunity.
So if you have any questions, we'll take them in badges. We'll take them First five, please raise up your hand, identify yourself, and then the media houses you are coming from. Before we do that, Minister, I want to just go back to Tree, just do it briefly in Tree for us, then we can take the questions. Thank you.
Opportunity, what I said into the ears of what the gentleman said into my ears, I said it in Tree, but I think I'll repeat it in English. What he told me was that, Mr. Minister, I'll come to the office and tell you my side of the story. And he came to the office. Those who work here will maybe. And in fact, let me tell you the coincidence. The reason why people think, and I've heard this one too, that it was managed, it was staged. How did the guy meet the minister at the same time at the place? What really happened, I didn't know. It was after the minister that I heard that the gentleman came to the ministry looking for me at that time. And they told him I had gone to the hospital. And so he followed up to the hospital. So that's the coincidence, that's what really happened. The various health facilities, the security measures we are putting in place. You see, when issues of this nature come, it defines policy direction. And so we already at every health facility, we have some sort of security arrangement everywhere. The district hospitals, the regular hospitals. But this has given a cause for reviewing the various securities at the various health facilities. And so the Director General with my able CEOs will look at reviewing and then establish that connection between our health facilities and the police in the various districts or at the various destinations in the country, so that at any given point in time. My last words. One, I've made this point more than 5 times in my submission. One, nobody has the right to attack any health professional. Let's show sympathy towards them. Let's understand them. They work under in some cases, obscure conditions. And they're also human beings. So please, let us not make it normal. It is normal to attack health professional once he or she is not giving you the right attention. That's my first one. The last, let me humbly also appeal to the health professionals that the patients, the ordinary Ghanaian, they are our clients. So let's try to communicate with them at any given time, whatever is going on when they come to the health facilities. Let's communicate. They don't understand the work we do as health professionals. But I believe that when we begin to communicate with them, they will understand and appreciate what we go through. I thank you very much.
Oh, Minister, when do we come for our rights? My first question is, when should we expect a conclusion into the investigations? And secondly, I assume that even before you became a health minister, you had instances where people have to literally fight with health workers before some form of attention is given to their relative or sick person. What will you do about that? Because you will hear a lot of people say, until you express anger, sometimes they do not even give you a listening ear. So how do we salvage the situation such that I don't feel that way, and then sometimes endangering the lives of health workers?
Thank you very much. We'll take the next one. Please, let's go straight to the point because of the interest we have, or this story has generated. Let's go straight to the point.
My name is Josh Quinn. I work at TV3. So I have to take one to revisit the issue of medical negligence. There's one, maybe 2 cases that actually caused the nation a lot. So before this, what was the ministry doing to tackle medical negligence? I think it's an issue of great concern. And so the others that are saying that the nurse in question should test the law, because obviously I know that the leadership of the Ghana Registered Nurses and Midwives Association to advise themselves if their grievances are not met. So she has to go to court, file the complaints, and not the leadership. I think whilst she's also testing it, what do you think is the appropriate channel where our could actually use this platform?
Thank you very much. We'll go to GBC. Sarah.
My name is Sarah Furi from Ghana Television. Honorable Minister, I would want to ask you a few questions if it has come to your attention. That it seems this gentleman in question had in the past made some utterances about preventing someone from getting an emergency care during some protests that happened in the past. For which reason, others are seeing it as a tit-for-tat event. I was told that there was someone bringing his child to 37 military hospital during the process, and he stopped them, and a person's child died. So in this case, it's like karma coming back to him. So if the nurses refuse to attend to his relative or whoever, it serves him right. If it has come to your attention, have you also found out forensically whether the nurse in question has the arm or whatever dislocated? Because we need to prove that, so that it doesn't seem like we are all being used to push an agenda. My second question is that, has it come to your attention that our emergency response system is really poor, for which reason we saw what we saw at the Ridge Hospital, and what you would do about that?
Thank you. Okay, Minister will respond to the three, and then we'll take another batch.
That's my first one. The last, let me humbly also appeal to the health professionals that the patients, the ordinary Ghanaian, they are our clients. So let's try to communicate with them at any given time, whatever is going on when they come to the health facilities. Let's communicate. They don't understand the work we do as health professionals. But I believe that when we begin to communicate with them, they will understand and appreciate what we go through. I thank you very much.